a brief overview of what vitamin C has done and talk a little bit about the mechanisms and then go on into some of these new applications. And then I can probably finish up 10 or 15 minutes short of an hour and entertain questions if that's something everybody would like. Oh, and I got to say, Dr. Lim said the applications weren't really new. I think they are. Okay, as before, if there's a number, you can go straight to PubMed and get the original article or the abstract and see that I'm not pulling stuff out of thin air. This was mentioned earlier. I won't dwell on it, but what has vitamin C already been proven to do? Not suspected to do, but proven to do. Well, the first stage is in vitro, which is in the test tube, and vitamin C has completely rendered the poliovirus non-infectious. So non-infectious that even when it's injected directly into the monkey's brain, a pretty brutal sort of experiment, no polio results. Herpes virus, very effective as well. Vaccinia viruses, all of this, very well. Enteroviruses, all of these in vitro, incidentally, so in the test tube. Influenza virus and rabies virus. The point to take from this is, to the best of my knowledge, and I've pored over PubMed for many hours, I guess probably many months, if you add all the hours together. And it's my impression that there does not exist a single virus with which vitamin C has been brought into contact that it has not neutralized or inactivated. Now, it's a very important point when you think about the major public health scares we have are new viruses. Oh my God, here's one that's finally going to wipe us all out. I don't know, maybe one will occur, but so far they have plenty enough in common that vitamin C has the mechanism to deal with all of them. And just a little background, I think most of you have heard about one of Klenner's amazing early papers. As Dr. Saul said, he was a pulmonologist, but he still got in the emergency room referral circuit his share of just patients off the street. And I think it was in 1948, they had a polio epidemic in North Carolina, and the babies and children were just pouring into the emergency room. Dr. Klenner also, I might add, documented at least half of these cases by spinal tap, so it wasn't just some silly non-specific virus or what they call 24-hour virus or something along those lines. Now, what Dr. Klenner did was, these were babies and small children. So some of the small children he could put IVs in, but most of them he gave intramuscular. And even though the doses that he gave didn't come close to some of the super mega doses he gave, even counting for body size, that the adults got for a wide variety of infectious diseases, he completely cured 57 out of 60 cases in 3 days. And he required 2 extra days to resolve completely and cure the other 3. So that's what you call an effective therapy. I think that calculates out to, let's see, 60 into 60. That's 100%. Sarcasm, folks, sarcasm. Okay. Now, also very interestingly, he didn't have a big series of these, but he reported on one young girl, I think she was 8, 9, 10 years old. She already had polio for like a full 2 weeks, and her legs were flaccid, paralyzed. Flaccid was just dangle, no life, no nothing. Well, he was able to completely cure her too, but it took about a couple weeks of vitamin C rather than 3 or 4 or 5 days. To add to some of the tragedies that we've already talked about, I might point out that Dr. Klenner went to present this information to the American Medical Association in Chicago in 1949. And he did get a chance to present it. He presented his findings. Didn't really stir any reaction at all from the crowd. Surprise, surprise. But what did stir a reaction from the crowd is right after Klenner finished showing how he could cure polio 100% of the time, some Joe Sixpack doctor comes up and presents his latest findings with the iron lung. The iron lung is actually, a lot of these polio patients would get such weak muscles they couldn't breathe without the assistance of the iron lung. And that was just wonderful, received warmly, and then we haven't changed a bit to this day. I mean, we just want treatments that cost money and ameliorate symptoms. Devil be damned about preventing the disease itself or curing the disease. Okay, so vitamin C has resolved all acute viral syndromes for which it has been adequately dosed. I emphasize acute. Chronic is a different ball of wax, okay? But acute viral syndromes, there's not a one that adequately dosed vitamin C has not resolved. Now, Klenner not only used infusions of vitamin C, he played around sort of like Dr. Cathcart with very large doses of oral vitamin C as well. And he was able to show pretty much over a slightly longer period of time, 10 days, that giving 50 to 80,000 milligrams of vitamin C each day could resolve polio in those individuals. So basically, Klenner showed the logical conclusion that, not surprisingly, oral could do what IV did. You just needed larger doses and longer periods of time. What did I do? Okay. And those are some of the similar formulas Dr. Saul showed you. And oftentimes, and this is something that maybe you could say I've expanded on today with the multi-C protocol, but Klenner was quite big, and it made a lot of sense, and it had a lot of success by adding different forms of vitamin C. So he would very often give intravenous in very large doses and just add a minimum of 10,000 more milligrams of vitamin C orally per day. Another acute virus that to this day causes a great amount of morbidity and mortality is hepatitis. And again, chronic hepatitis is a different story, but acute hepatitis most of the time can be resolved with vigorous vitamin C therapy with astronomical liver enzyme elevations coming down to normal within 7 to 10 days. Now, for those of you who've ever had to deal with acute hepatitis, this is a bad disease that people say stay sick for months, they stay bedridden for months. So any one of these diseases for which vitamin C has gotten these phenomenal results would label it a wonder drug if it had come out from a pharmaceutical group. Some of the most spectacular stuff he did, I haven't ever had the opportunity to treat, well, that's not quite true, maybe once or twice. Before I knew about vitamin C, having a patient present with acute encephalitis and go into a coma in front of my eyes over an 8 or 9 hour period and then die in the middle of the night, 12 hours after he admitted to the emergency room, with the only chief complaint of coming from his wife. And his wife said, "Doc, he's not right." I said, "What do you mean he's not right?" I said, "Doc, I've been married to him for 30 years. He ain't right." And I had done all the blood tests. All the blood tests looked fine. X-ray looked fine. And I swear, and I'm getting ready to discharge him from the emergency room, and his wife got a little panicky and said, "Doc, I'm telling you, he's not right." So that was probably the flimsiest grounds in history to do a spinal tap. Wife says, husband is not right. And I did a spinal tap, and it wasn't too abnormal, but there were just a few extra cells in it. So I said, I can't deal with this fella's wife anymore, so let's just admit him for observation. And then I had the most horrific night of my life, watching this guy go from what to me looked normal to being dead 12 hours later. And this is how vigorous viral encephalitis is. Klenner actually took a number of these patients who were already in a coma, brought them out in a few hours, and discharged them several days later. Here's the New Zealand farmer thing. I didn't see a lot of hands today. If you haven't seen the New Zealand farmer, 60 Minutes New Zealand, you can get it on YouTube, but you can also go directly to my website, peakenergy.com, and click on it there. And I'll only tell you this. It's about 16 minutes, and unless you're made of stone, you better have your Kleenex ready. They were talking earlier today about how effective the vitamin C was, and then after a couple days, they stopped it. Well, not exactly. There's a little story behind the story there, and I'm just going to go off on a slight tangent for a moment and tell you that after 2 days, his x-ray was clearing up, and they were still fighting to get more doses of vitamin C, and the doctor in charge, now get this, he did not discontinue the vitamin C. He went from 50 grams twice a day, 100 grams, to 1 gram twice a day. Now, what does that tell you? If the doctor thinks the vitamin C is not worth anything, you stop it. If he thinks it's doing good, you continue it. But if the son of a bitch wanted the patient to die while still receiving vitamin C, that's what you do. That doctor should be incarcerated today. And this is still the state of affairs we're all dealing with, as I'm sure all of you know. Now, and incidentally, as you're going to look at this slide and a few others, bear one thing in mind. I'm not going to go off into a big tangent about vaccinations, although to me vaccinations represent the #1 public health problem in the world today. I would never, my personal opinion, based on my review of the evidence, I would never give anyone of any age any type of vaccine for any reason at all ever in their life. But other than that, they're fine. Vitamin C has already been shown to cure or prevent, depending on how much you take before your exposure, to cure or prevent every infectious disease for which vaccinations are offered. Duh. Taking care of measles, mumps, chicken pox. Never been able to treat rabies because you're never going to get a patient in a hospital where they'll not go through the huge, horrible series of rabies vaccinations. So that's just a subset of patients that you're never going to get the opportunity to show But vitamin C in animal studies has been, rabies responds and is eradicated just as easily as any other virus. Just a quick itemization, in non-viral infections, vitamin C has been highly effective in cures. That four-letter word you hear of, cures. I've often said it's as much or more of a crime to talk about something that can cure something and not say it can cure it just because you don't want to, you want to avoid the controversy. But it's cured diphtheria, tetanus, all forms of staphylococcus, streptococcus, pseudomonas. Those are a big three. Staphylococcus, streptococcus, pseudomonas. They take down patients, babies, children, teenagers, and adults, and nursing home patients in huge numbers every day around the world. And it does not have to happen. So, vitamin C is what I call an absolute viricide, meaning it will, you can't really kill a virus. A virus isn't alive, technically. But for the sake of argument, let's say it kills or inactivates any virus such that it can no longer function. It's often bactericidal, meaning it'll kill a bacterial pathogen. It's almost always bacteriostatic, which means it'll stop a bacterial pathogen from replicating, and then the immune system can jump in and finish up the infection. And very significantly, it's always strongly supportive of an optimally competent immune system. And I'm going to show you about 20 different ways in which it does that. Now look at this. Other non-viral infections: malaria, leprosy, typhoid, brucellosis, trichinosis, dysentery, and trypanosomes. Now, two of those right there kill an enormous number of people every day. Which two do you think those are? Malaria and dysentery. And both are easily cured. That four-letter word again. Okay? There's at least 19 different ways. I see at least 19 because, I don't know, maybe if I'd have reviewed PubMed for another 4 or 5 hours, I'd have found another dozen. But there's at least 19 ways in which vitamin C supports and or improves immune system functions as established in the scientific and medical literature. Number one, it increases interferon production. It makes phagocytes that consume bacteria more powerful. Guess what? A monocyte has 80-fold, 8,000% more vitamin C than the surrounding plasma. So when you get an inflammation, usually secondary to an infection because that consumes the vitamin C and causes the inflammation, you have an immune system response to the inflammation. What's the first white blood cell to show up on an immune system response at a site of inflammation? Monocyte. And I just said the monocyte has 8,000% more vitamin C than the surrounding plasma. So I would submit to you, it's my conclusion, that the body just has another compensatory mechanism for when an area becomes acutely inflamed and massively depleted in vitamin C. The cells with the most vitamin C are the first cells to show up. Very, very logical, very nice. Vitamin C clearly enhances cell-mediated immunity, T lymphocytes, and it clearly enhances B cell production and the B lymphocytes. Now, one brief mention again about my little buddy Vaccinations. I know right now there's certain areas of the world and certain states in the United States where you're fighting jail time if you don't get your kids vaccinated. So I'm not going to be judgmental of somebody that ultimately decides they have to buckle under and subject their child to a high chance of autism or related illnesses, because make no doubt about it, that's what causes 100% of it. But vitamin C does two really big things. I just said one, it enhances antibody production, and number two, it neutralizes toxicity. Now, if you think if the vaccine is doing some good, well, the vitamin C is going to make it do it better because you'll get more antibodies. And there's no doubt that the side effects of a vaccination are all toxic in nature, and vitamin C is your ultimate antitoxin. So actually, if you go to Dr. Saul's orthomolecular medicine news service site, a couple years ago, I wrote an article outlining how it's really very simple dosing vitamin C several days before, the day of the vaccine, several days afterwards. We haven't compiled the statistics, but I would be flabbergasted if any baby got autism on that regimen. Now, enhances nitric oxide production. Another one, enhances natural killer cell activity. This is another thing when we're talking about treatment of cancer patients. Prostaglandins, and the rest you can read for yourself there. Now, as if vitamin C wasn't amazing enough in what it does is in infections, what it does to toxins is near miraculous. And I think it's far and away, well, not far and away, but perhaps even more impressive than the anti-pathogen properties. There has never been a toxin against which vitamin C has been tested that it does not neutralize. This was one of the things I struggled the hardest with when I first saw and witnessed and used for myself and saw what vitamin C could do intravenously. And I saw the articles of Dr. Klenner, and I saw that vitamin C would stop dead in its tracks the poisonous or toxic effects of any toxin if you gave enough of it in an infusion. And I said, how can one simple molecule neutralize or block the toxicity of literally thousands upon thousands of different toxins with different chemical configurations, physical properties? And it's all because of what I talked about yesterday. There's a final common denominator of damage that all toxin inflicts. Doesn't matter what the toxin is, it inflicts its damage by promoting, either directly or indirectly, oxidation of biomolecules. Sometimes those biomolecules are critical to immediate health, like cyanide. Others are like mercury, and you just accumulate them and get sick as hell 30 years later. But we've seen it neutralizes all the heavy metals, neutralizes snake venoms, and it does it rapidly. Klenner talks about one fella that came into his office, plopped himself down on the stretcher, and he said, "Doc, I'm dying." And I think this was the brown recluse spider bite, okay? And Klenner saw that he was going out while the nurse was taking a blood pressure, and he was very hypotensive, well below normal, in shock. Klenner said he drew up, I'm not exactly sure, 15 or 20 grams of vitamin C in a large syringe, undiluted, 500 milligrams per cc. And in Klenner's words, he pushed it as rapidly as a 20-gauge needle would allow. And before the syringe was halfway down, the patient's eyes started lighting up and his blood pressure started coming back. And that's how dramatic it can be if there's a large amount of toxin still circulating in the blood, and the vitamin C can meet it in the blood. Now, and just remember, I'm not saying it needs to be done that way, but do understand that vitamin C IV push in its most concentrated form is still harmless. If you have a very sensitive person with small veins and it hurts, well, you might cause some phlebitis there. That's the possibility. But if you get a large vein, anticubital, most of the time you can give it as much as you want and as fast as you want if you're in an emergent situation. After I saw that little passage by Dr. Klenner, it was about 20 years ago. I got me a syringe, and I got me 20 grams of vitamin C and 40 cc's of solution, just as you get directly out of the vial. And I got my butterfly. I said, I hope Klenner wasn't exaggerating. But I needed to do it because I didn't want to do it to anybody else till I did it to myself. No problem. The only problem was wiping up the little puddle of sweat that I sweat on top of my desk while I was going through the process. And that has opened a lot of doors. I'm going to tell you a little later some of the things Dr. Ron Honeyhacky and I have been doing at the Reardon Clinic, which, with all due humiliation, I think may revolutionize vitamin C therapy and the treatment of many diseases, but I'll get into that in a moment. I got to keep you awake. If you fall asleep, it's your fault. You won't hear about it, okay? Vitamin C neutralizes alcohol. Not recommended for drinking and driving, but it would probably get you out of it if you needed to get home and you didn't have 4 or 5 hours to spend sitting around. A good IV would knock the alcohol levels down pretty quick. Barbiturates also. Toxic mushrooms. Very, very horrible toxicity. Causes liver failure, good reason for liver transplants. They had a little French guy who found that vitamin C and a combination of a couple other things would completely block the toxic effects of mushrooms, the Anophelloides, Amanita phalloides toxic mushroom. Well, he was on the circuit giving talks, I suppose, maybe like I'm giving right now, and he had a flair for the dramatic, and he would bring with him 3 times the fatal dose of toxic mushrooms with him, so he could eat them in front of everybody, and then take his vitamin C. Well, you won't be seeing me do that. But I'm glad he survived. Strychnine and tetanus, a lot of, there was one tetanus patient that Klenner shared with another. He was like a consultant, and then the patient had his primary. And the tetanus, they would yo-yo back and forth. They'd give the anti-tetanus IV, and the patient would get worse and get sicker, and then Klenner would come along and give some IV vitamin C, and he'd get better again. And so they just yo-yoed this poor kid back and forth for about a week until the vitamin C finally prevailed. Now, chronic infections, Lyme, AIDS, chronic hepatitis, these have what are called, for lack of a better word, embedded pathogens. Remember, nothing, antibiotic, immune system, vitamin C, nothing is going to destroy a pathogen if it can't get physical access to it. So you have physical considerations in the effective treatment of any infection. Most acute infections are not embedded. They're still readily accessible in the blood, in the extracellular fluids, But some of these chronic infections actually find their way to embed themselves even into the DNA of the cells. But a lot of evidence to show that when you dose highly, and again, Dr. Honeyhackey and I have a protocol at the Reardon Clinic called the ascorbazone protocol, which combines ascorbate, vitamin C, with ozone therapy, okay? And it's pretty impressive. I'm not going to tell you we cure every case of Lyme disease, no, but some of them, yes. The common cold, tuberculosis, it's amazing. They have a ton of literature in the 30s and 40s and 50s on tuberculosis and vitamin C and everything it can do. And now they're just rediscovering that fact. But that's okay if they think they're the ones that discovered this, maybe that'll allow it to finally become accepted. Pertussis, Dr. Suzanne Humphreys has a very large amount of experience with this. It's somewhat unique because it's a combination infection with a horrible toxin. And unlike so many other things, if you just give intravenous vitamin C for pertussis, that's not enough. You need to give oral as well because of what it does to the gut. Dr. Yanagisawa demonstrated that vitamin C completely neutralizes radiation toxicity. And just remember, all biochemical damage is oxidation. And radiation can oxidize, or a physical molecule can oxidize. The same thing happens, which is vital biomolecules lose their electrons and become oxidized. And when you take enough to repair that damage, especially if the radiation exposure has ceased, you can get a remarkable improvement. I mean, there were some absolute horror stories about after the nuclear accident in Japan with these incredibly brave Japanese men that just suited up and went straight into the heart of the plant. I don't know if Dr. Yanagisawa got to those folks, but he was able to get to a lot of other people that were more peripherally and less intensely exposed. So, the practical considerations then. Remember, we're supposedly talking about vitamin C and infection. Believe me, I'm gonna get to it. Vitamin C, how does it do such a fabulous job? Well, just as a categorization, number one, it significantly enhances immune function in at least 20 different ways. It has its own direct anti-pathogen properties, okay, utilizing something called the Fenton reaction, where it donates an electron to Fe3+, makes it Fe2+, then Fe2+ donates that electron to hydrogen peroxide, and even though all vitamin C did was donate an electron, the result of that electron finally making its way into hydrogen peroxide breaks it up into the most potent oxidizing substance on the planet, which is hydroxyl radical. Hydroxyl radical is so potent it doesn't migrate. It doesn't migrate because it immediately oxidizes whatever it's next to the moment it's formed. Vitamin C, of course, neutralizes toxins, and there's not only endotoxins and exotoxins, but there's also the toxins of the pathogen metabolism. I mean, the pathogen metabolism doesn't produce nutrient antioxidant substances. It produces oxidized toxic substances. Vitamin C, of course, repairs oxidized biomolecules. And then finally, if let's say you're trying to get a foothold into a hospital with vitamin C, you can take the approach of, well, let's just check the vitamin C level on this deathly ill patient. And guess what? It's always going to be low. Now, you're going to say, well, if we find a blood test that has a low level of anything, let's say potassium, you have a low potassium level, what are you obliged to do as a physician? Give potassium. Now, if you documented by laboratory values that your vitamin C level is low, what are you obliged to do? Give vitamin C. I'm not saying you still might not meet some resistance, but they being the loyal opposition, really reveals themselves to be the obnoxious, stubborn pigs that they are if they would stop you from using even small amounts of vitamin C. And I'm going to tell you, small amounts can do the trick. The New Zealand patient, guess what? They stopped him. They put him on 1 gram twice a day. They thought he was going to die, but he didn't. He kept on 1 gram twice a day, and then the family started sneaking in liposome encapsulated vitamin C, and the old son of a gun burned him and survived and went on TV to tell everybody about it. Now, what are the most prominent promoters of chronic degenerative disease infections? Of course, you know about the dental. I don't have a lot of time to go into detail there, but since I'm not making a presentation on this, and it was covered in the new book, Hidden Epidemic, I want to tell you, I want to make it perfectly clear, okay, that any patient with heart disease, any patient with breast cancer, if you don't do a 3D X-ray of their mouth, you are now officially committing grave malpractice because you are not giving that patient their one real chance of either reversal of their coronary artery disease, objective reversal of the atherosclerosis, or cure of their cancer, okay? And to a lesser degree, it applies to all other chronic degenerative diseases. I think personally now, after looking at the evidence, everyone should get one of these scans when they first present to the physician, okay, for whatever reason. Even if it's a well-person physical, even if it's a kid going to play football when he's 18, do this, and if it's normal, great. And then if the kid starts getting diabetes when he's 30 years old, you do it again and make sure some infected tooth hasn't put him on the downhill spiral. And many times, likely a majority of the times, it's going to be there. The statistics now show that 10 to 15 to even 20% of all adult teeth around the world are infected. And if you keep an infected tooth in your mouth, you're going to get sick and you're going to stay sick, okay? And that sickness can be anything under the sun, because all sicknesses are increased oxidative stress intracellularly. And these infected teeth almost always, by what do I mean almost always? I mean 97, 98% of the time are asymptomatic. So you don't know it's in there if you don't look for it. Do you ever see a patient come in and say, wow, there's a diabetic patient? No. Or you never say, wow, blood sugar 350. No. You got to check their blood sugar. They might not even be diabetic, or they might be the worst diabetic going. Same thing with the mouth. You don't look at somebody who's not having pain in their mouth unless you have X-ray vision. Remember that old show, the man with the X-ray eyes? Okay, if you fall into the majority of people that don't have X-ray vision, you got to check these patients out. It is, and then I'll move along from here, in my opinion, the single most important thing you can do for your patient, and not to lessen anybody else's impact, but in terms of your patient, it's going to be the single most important thing that you pull away from this conference. Now, outside, and of course, infections provide the most toxins. That's why they're so bad. Other toxins, toxic iron status. I mentioned this in the previous lecture. I'll tell you now. Dr. Levy iron video. You won't believe it. Okay, this has been going on for 75 years, where they've been putting in metallic iron filings in our food. metallic iron filings. That's why God created plants, so we don't have to eat metal directly. Okay? And of course, the other toxic supplements, calcium, copper, and iron. Although, as I mentioned earlier, I'm blown away by what this one unique calcium product does. But bearing in mind, of course, it's a tiny amount of calcium, and it just appears to be regulating calcium metabolism and not leading to accumulations. Poor digestion generates a lot of. And then finally, hormone imbalances. Everything that's bad for you is worse if you have a low estrogen, low testosterone, or even a minimally low thyroid function, T3. So, therefore, treatment's principles. Now, what's the primary aim of any vitamin C-centered protocol? I would tell you that the goal is always the same. The goal is to get as much reduced, that's not oxidized, reduced vitamin C inside the cells as possible, okay? And the more ways you can manipulate the parameters that allow you to get intracellular levels of vitamin C elevated, then everything else falls into line, okay? That's how focal and significant vitamin C is in your body, okay? I mean, obviously, there's other things that are important, but if you have elevated intracellular oxidative stress, and you have a vitamin C deficiency, which you will have if you have the elevated oxidative stress, everything else will pale in comparison as a therapeutic goal. All right, now this is an old slide, and I'm going to use it to point out some things that are changing. We've always said, well, I've always said, the number one factor for vitamin C efficacy and administration is, just like they say, the three most important factors in real estate are location, location, location. And then, of course, you know, the three most important factors in French cooking: butter, butter, and butter, okay? And then finally, the three most important factors in vitamin C therapy is dose, dose, and dose, okay? Now I'm going to tell you, we're starting to get some information, and I'll show you the evidence in a moment, that shows frequency in some settings might be even more important than dose. We're just starting to see the patterns develop, and this may not be the case in 100% of clinical situations, but I'm going to show you one that's going to rock your world. So we have dose, route, rate, frequency, duration, type, adjunct therapies, and the overall protocol of administration. Oral encapsulated vitamin C. I started with this some 11 years ago, and I made my own observation. So if you go online, and this isn't ego, I'm just telling you this is the way it is. If you go online, you're going to see something that's derived from my initial quote, which is oral liposome encapsulated vitamin C appears to be dose-wise 5 to 10 times more potent than intravenous, okay? Now, they both do good things, but I can tell you I got greater control over an acute viral infection with 5 grams of oral vitamin C liposome encapsulated at one time than I got with 50 grams intravenously. And to make a long story short, what it does is it gets the vitamin C inside the cell without the consumption of energy. When you give it intravenously, if the active vitamin C goes in, it takes the vitamin C transporter, the SVCT2, that consumes energy. Or it goes in by the GLUT The oxidized vitamin C goes in by the GLUT transporter that also brings in glucose. And once it's inside, you still need to consume energy to make it active again. So, also the phosphatidylcholine has great supplemental value as well. We see the back and forth stuff about cancer and all. I can just tell you, although it was iffy 10 years ago, we now have an enormous amount of hard, very solid scientific data showing, much to the chagrin of the oncologist, it's like about, I don't know, 8 or 9 years ago, again, at conferences like this, and again, no ego, maybe it was something I said, but I did strongly make the point that chemotherapy is a toxin, and vitamin C will neutralize that toxin. And so, again, it's almost, you could hear a collective cheer out from the oncologist that, oh, now we have a real reason to deny people getting vitamin C along with their chemotherapy. So then it took the next 7 or 8 or 9 years to re-hammer down the point that as long as you stagger the dose, take one at point A, take the other one 3 or 4 hours later, there's absolutely no loss of the chemotherapy, but there's tremendous reduction in symptoms and tremendous reduction in repair of the normal cells that get damaged. And we have the studies to show quality of life, length of life, size of tumor, symptomatology, all dramatically improve when vitamin C is combined with chemotherapy, if you're so inclined to use chemotherapy. I wouldn't recommend it, but again, just like the vaccination, I understand the pressures that a lot of people get put under. I had one pediatrician come up to me at a conference not too long ago after I talked about using vitamin C to make vaccinations less toxic. And she said, oh, I'm so glad to hear that vitamin C does that, Dr. Levy. I said, okay. He said, you know, vaccinations are my bread and butter. I just had to nod and walk away. Okay. Now, the multi-C protocol. Oral liposome encapsulated, you get optimal intracellular access. Multi-gram doses of sodium ascorbate, you neutralize toxins in the gut and get a lot of C into the surrounding immune cells. Ascorbyl palmitate is a fat-soluble form, gives you a better protection in the fatty cell walls of the body. Intermittent IV, okay, as often as you can have it and afford it and take it, the better. An intramuscular administration of vitamin C, remember the success of Klenner, okay? Regular intravenous, you go whoomp, whoomp. So you get a big spike and then it starts to flush out and get excreted in the urine very rapidly. What happens with intramuscular? Rather than like this, you go up slow and just maintain a bit of a plateau and then go down. Even Dr. Klenner in one of his papers many years ago, and remember, you could not give IV vitamin C in the hospital. And only now is that changing just a little bit, but absolutely, in Klenner's day, not possible. But he speculated. He said, well, I suspect that if you could give, and he picked the figure 300 grams, as a steady infusion around the clock, we'd see even more remarkable results. And I got to tell you, I'm firmly convinced he's right. The only thing I would say is you don't need to use a dose nearly as high as 300 grams. Dr. Honeyhacky and I have been working on a lot of IV push applications. with some enhancers, and I'll discuss those in a moment. Mopup Vitamin C. It's interesting. Every now and then you give a large amount of vitamin C and the patient feels horrible. Well, if they have cancer, it's because you're killing cancer cells and releasing debris and iron into the blood. Or more often, it's an older patient who's been accumulating toxins all their life, and you give such a large dose of vitamin C all at once, it gets into the cell rapidly. It reduces those oxidized enzymes that are natural detoxers, okay? When you reduce an oxidized biomolecule, what happens? It regains its function. So this detox enzyme starts doing its work and kicking toxins out like crazy, and you get the so-called Herxheimer reaction, okay, which originally came about when syphilis patients got a large dose of penicillin. They just started killing off spirochetes like crazy and just about killed the patient in the process. Well, guess what? Guess how you treat that? You treat something that vitamin C causes with more vitamin C, okay? But you use a lower amount at a slower rate such that you're not going to continue to get a massive uptake into the cells. You're just going to flood the blood. Flood the blood. I like that. You're going to flood the blood with vitamin C and neutralize the toxins that have been released. And let me tell you, the real practical point about this is not only do you want to be nice to your patient and make them feel better, but if you give them a nice big IV vitamin C that they spend several $100s for and they leave the office feeling sick, good chance they won't come back. Okay, so it's important from a number of different points of view. Now, got all these killer viruses out there, or at least that's what the CDC would have us believe, and the World Health Organization, and just about every movie studio in Hollywood who comes out with these one-word epidemic movies, you know. Well, remember the Ebola virus. Remember, it was just, if you got in the same city with an Ebola virus, you're a dead person, okay. Well, Dr. Rowan, Robert Rowan, works a lot with ozone, and let me tell you, ozone and vitamin C, I can't tell you which one works better. They both work fabulously. And Rowan had announced his plans to go to Sierra Leone, and I gotta say, that's a little bit like the French guy. That was a pretty, shall we say, large cojones thing to do. Okay, to go and expose yourself to what everybody is saying is a death sentence. But he was determined to do it, and I know him not that well, and I called him up, and I said, Bob, I said, I hear you're going to go to Sierra Leone and cure some Ebola. He said, that's right. And I said, I know and you know that the ozone by itself will easily cure the Ebola, no problem. He said, but I very much want you to succeed. I don't want to see some patients die in the process. And if you treat some of these African natives that don't have two antioxidant molecules knocking against each other anywhere in their body because of nutrition, you're going to nuke that Ebola virus with the ozone and massively flood the body with oxidative debris, and you could kill somebody. And I said, I would encourage you to add vitamin C to the regimen just as nutrition. And he did, and he cured 4 people in a row, and then somehow got out of Sierra Leone alive after that. Ebola and these viruses that are really bad are called acute hemorrhagic viruses. That's because they pretty much consume every molecule of vitamin C in your body very rapidly and cause a massive hemorrhage as the terminal event. So, chikungunya, horrible virus. It doesn't necessarily kill as quickly or as easily as some of the other dread viruses, but it's probably the most brutal symptomatic virus that is. Okay, you get chikungunya, you get an acute arthritis, you don't want to move. It'll take a young person and put them in bed, okay? Sometimes for months or years, okay? Well, Dr. Gonzalez showed that high-dose IV vitamin C completely nuked chikungunya, no problem. My wife is from Colombia, and she and her friend came back from Colombia where they were having a chikungunya epidemic. And another lie, too. It's got nothing to do with mosquitoes. Okay, I saw whole families with beautifully well-maintained house, nobody going outside, nobody's getting bit by a mosquito, and they're all coming down with chikungunya. I don't think there's any question around the fact that it's airborne, okay? But be that as it may, my wife and her friend were otherwise fairly healthy, so they had sort of pushed back on the virus, but they were still feeling pretty bad. Well, her friend, now they tell you not to do this, okay, so I'm not advocating you do this, but they've given slow IV push ozone in Germany for hundreds of years, okay? They officially tell you not to do it in the United States, basically because doctors have a lot of cowboys out there, and they just want to yeehaw and just do everything possible, and so next thing you know, they're going to kill somebody, and you can't kill them for sure when you do the out-of-body washing with the ozone. But anyway, you go slow, the IV ozone is fine, and I gave the friend, about 20, 25 cc's. It is unsettling at first when you see your IV pushing a gas, but, and so the syringe is halfway down, and her eyes get as big as cartwheels, and she says, is it possible for all the pain to have gone away already? So that's how quick it reacts. And then my wife, she doesn't like the ozone, so I gave her IV vitamin C, an infusion. Same thing, halfway through the IV infusion, her eyes are rolling around in her head too because she's pain-free for the first time in months. So Zika, think how many Olympic athletes blew their chance at a medal because the press and the CDC scared the ever-loving hell out of them. And what it does to babies, I don't know. I still don't know the truth on the microcephaly with the Zika. But bottom line, Dr. Gallus again at the University of Puerto Rico showed high-dose intravenous vitamin C easily nukes Zika. Okay, so now, connect your seatbelt. I don't want anybody falling out of their chair. Okay. I don't want to be responsible. Okay. Vitamin C and sepsis. This all started about 7 or 8 months ago. I must say, quite humbly, I always said that vitamin C will have a breakthrough the day there's a doctor in a small hospital who's king of the hospital. Nobody tells him or her what to do. He gets to do anything he wants. Nobody objects. The pharmacist can't say, I can't do that, or he knows he'll get kicked out of the hospital. So this was a setting at a small medical school in Virginia, and Dr. Paul Marek treated sepsis patients. Now, a little background on sepsis. Sepsis is the #1 cause of hospital-based death. It kills, of people that die in a hospital, 40, 50, 60% of them die from sepsis. So it's statistically a very consequential thing. Well, he had watching all his patients die. He had actually, to his credit, in a video, he made some snide comments about me, but that's another thing beside the point. But he did review the work of Dr. Klenner, and he knew that vitamin C had validity for infections, okay? And they're always in the habit of giving hydrocortisone for shock, even though in septic shock it does no good at all. So he had this young lady, now think of this, it's very important, dying of sepsis, and Dr. Marek said, I don't expect she's going to be alive in the morning. So give her 1.5 grams of vitamin C IV now in every 6 hours. Give her 25 milligrams of hydrocortisone IV now in every 6 hours. And then he went home fully expecting her to be dead the next day. She was up, eating breakfast. Now remember, the next day, the next morning wasn't that far away. She basically did most of her recovery with 3 grams of vitamin C intravenously and 100 milligrams of hydrocortisone. Okay? This just suggested all sort of crazy things were happening. It also immediately showed a little bit that we got a hint of with the New Zealand farmer, that perhaps repeated treatments are even more important than how much you can give at one time. Now, as it turns out, many sick patients that have mild illnesses, they use up their cortisone and they are cortisol depleted. But in the case of the sepsis patient, what do you have in sepsis? You have massive body-wide oxidative stress from the horrible infection. And these are people in shock, they're already on maximal antibiotics, everything else, and they're going down the tube. Well, what happens is the cortisol receptors are inside the cytoplasm, and they're almost all oxidized. So what happens when you have an oxidized receptor? It doesn't work. And so the body sees these oxidized receptors, the hydrocortisone can't have its effect, and what does the body do? The body makes more hydrocortisone to try to overwhelm that, but it ain't going to do it. What happens when you just give a little dose of vitamin C? You reduce all those oxidized receptors, hydrocortisone kicks in, and at the same time, the cortisol dramatically increases intracellular uptake of vitamin C by the SVCT2 receptor. Dr. Honeyhackey, we did a little study, and we showed that when you take vitamin C orally, either liposome encapsulated or regular, and then you take a dose of hydrocortisone, you get a massive, massive increased uptake of vitamin C inside the cell. And what did I say was the goal of all this? As much vitamin C inside the cell as possible. So this was his protocol. He also added thiamine, which is really irrelevant and beside the point. But look at the mortality. He had something that was killing 40% of the people. He did, I think it was 47 patients in a row, and only 4 of them died, but they died of the consequences of their disease, not of shock. He brought them out of the shock, and they later died from the disease. So what this is as far as septic shock mortality goes, this was 40% reduced to 0. And he followed that up with another 100 patients and got basically the same result. Now, of all places, Iran kicked in with a study. I mean, I said, wow, that's good. Contributions all over the world. I like it. Iran and some Iranian investigators took septic shock patients and gave them very comparable doses of vitamin C. Rather than 6 grams a day, they were getting 7 to 10 grams a day, intermittent doses IV, every 6 hours. No hydrocortisone, no thiamine. Same result. You didn't need the hydrocortisone to be administered because you already had a lot of hydrocortisone circulating in the body. What you needed to do was reduce those oxidized receptors inside the cell so they could bind the receptors and have the multitude of positive effects that hydrocortisone has. And now this has initiated a huge amount of studies. For the first time that I know of, there's now a number of institutions around the world, at least with this study, permitting the administration of vitamin C intravenously. As I say, the genie is now out of the bottle. And they may try, but I don't think they can put it back in. So, let's see what else I got here. So it's important to understand then that, I'll go to this slide, ascorbic acid and hydrocortisone are the two most powerful anti-inflammatory agents there are. They're certainly the two most powerful anti-inflammatory naturally occurring agents, but I really can't think of any medications that are more powerful as an anti-inflammatory as well. I mean, you know, you could give an astronomical amount of prednisone and give all the side effects, but as far as something that's good for you, and the two things work synergistically. That's the amazing part. They're synergistic. Let's see. I think I have a series of, and you'll get the whole. Okay. Just to show you some of the data that's present, these are all pertinent articles. Vitamin C along with vitamin E will shorten the length of an ICU stay early on. We have that out there. Parenteral vitamin C protects septic mice against most aspects of abdominal sepsis. Again, showing vitamin C can do it by itself. I mean, I'm absolutely ecstatic that Dr. Marek did what he did. And even if septic patients forever need to get vitamin C, hydrocortisone, and thiamine, that's okay. But vitamin C does it by itself. Patients with severe sepsis receiving only IV vitamin C showed prompt improvement in the clinical organ failure, as well as the CRP, C-reactive protein. Vitamin C lowers histamine, which plays a role in non-septic shock. Parenteral vitamin C has been shown to effectively treat sepsis and sepsis-related organ damage in mice. And vitamin C by itself, along with other things, has also effectively treated the sepsis-induced variations of the adult respiratory distress syndrome. And I don't know how many cases you might have had in your life to see of ARDS, but that's one vicious disease. I mean, somebody gets aspiration pneumonia or goes into ARDS, oh hell, they're going to die 50% of the time. So if you can start making people like this better, we're unveiling sides of vitamin C that we've never seen before, and at lower doses than we ever imagined possible. Corticosteroids upregulate the vitamin C transporters, increasing, let's see. So it's basically like insulin resistance. You get glucocorticoid resistance in sepsis. And there's a few more you can work with there. So we're looking at the Reardon Clinic now of actually working together and getting patients to, hopefully, if the investment money comes in and things work out, we're going to have devices where patients can go home and get a steady infusion of vitamin C around the clock, much like Dr. Klenner envisioned many, many, many years ago. We're also seeing, we've been doing lots of IV pushes, okay? I'm going to tell you, let's see if I have it. Now, these are all experimental. I'm not telling you, I'm not suggesting to you. At this point in time, I would say don't go out and do it, but I want you to see what's evolving. At one point in time, I'll tell you a quick story just to demonstrate the power of this modality. The power of this modality is I had horrible back pain, so bad I really couldn't walk, and I had to take a trip the next day. I said, my God, I'm going to have to cancel the trip. I can't do this. But I had my vitamin C for IV. I had a bottle of regular insulin, and I had hydrocortisone, and I had magnesium. So I put together a 25 gram, which is 50 cc, of vitamin C, along with 5 units of insulin, along with, in this case, it was the size of the vial, 240 milligrams of hydrocortisone, and along with about a half a gram of magnesium. And I gave this huge volume, IV push, in a butterfly, and I got it all in 2 minutes. And other than having a warm flush, sort of like a short-term niacin flush, but it was, of course, a hypoglycemic flush. And then it all passed and I did fine. And then I said, well, let's make believe all this good stuff is circulating in my body, so I'm going to put a magnet over my back, a heating pad, this, that, or the other. And that night I went to sleep on the heating pad. They tell you not to do that, but I did it. And the next morning, I woke up and I immediately remembered that I'd had this back problem, and I said, oh my God, how bad is it going to hurt? And I moved gingerly out of bed, just waiting for every moment to give me a twinge, and I managed to get out of bed. Nothing happened. I stood up, and then I started taking a few slow steps across the room, and I said, good God, I have 100% pain relief. Now, that's also significant because I'm sure all of you have worked out at a gym at some time in your life. Some of you still do. And if you do it for the first time in a long time, what do you have 2 or 3 days later? You have the most horrible, deep-seated muscle pain imaginable, and it's going to take days for you to get rid of it. I got rid of deep-seated muscle pain in 12 hours. So think and apply that. Think of the potential possibilities for all the different diseases you treat, infection, cancer. Also, the economic impact, all right? It's not having to rig up an IV and extra nursing staff and watching somebody. Another things that we're experimenting too with is even if they're not in the hospitalized situation, if they're in your office, have them come in early in the morning, put a little IV heparin lock in place, and just give them whatever, 2 or 3 or 4 grams of vitamin C IV push every hour. So you're having pulsed vitamin C therapy. Remember, everything in nature is pulsatile. It's not static. And you damage with pulsatility and you make better with pulsatility. Look at the blood pressure. Look at how the electricity and everything inside the cell works. Okay. So, sort of like Dr. Saul, I'm going to terminate with the good words of Mark Twain. First one is, whenever you find yourself on the side of the majority, it's time to pause and reflect. And then finally, it ain't what you don't know that gets you into trouble. It's what you know for sure that just ain't so. So I'm happy to have come here. I'm glad to talk to you all, and perhaps we'll see each other in the future. Thank you.